After more than a decade, the American Academy of Dermatology and the National Psoriasis Foundation updated their guidelines for managing and treating psoriasis. Here's a brief summary of some key recommendations coming out of the revised guidelines related to psoriasis and comorbidities. First, all patients with psoriasis should be screened for psoriatic arthritis at each visit. Both dermatologists and patients should be familiar with psoriatic arthritis symptoms, such as unexplained morning joint stiffness or swelling. Joints in the hands, feet, knees, wrists, and elbows, as well as the spine, can all be affected, and the symptoms may resemble other conditions, such as rheumatoid arthritis and ankylosing spondylitis. The key is to catch psoriatic arthritis symptoms early. Cutaneous symptoms of psoriasis can arise years before any arthritic symptoms arise, but if arthritic symptoms present and go untreated, they may cause irreversible joint damage. Here's another key takeaway. Psoriasis, unsurprisingly, can cause significant psychosocial stress on a patient, and it may affect their personal relationships, their sexual activity, and their professional performance. Psoriasis patients are 50% more likely to develop depression than people without psoriasis. Dermatologists should be aware of how a patient's condition is affecting their quality of life and should look for signs of anxiety and depression. Patients might be unwilling to initiate a conversation regarding their mental health out of fear and concerns that they may be dismissed or stigmatized. Dermatologists should take the first step and ask patients how their condition has impacted their mental health and validate the patient's concerns and experiences. A third takeaway from the guidelines is that patients with psoriasis are about twice as likely to have irritable bowel syndrome or ulcerative colitis than people without psoriasis. Dermatologists should be aware of and educate patients on the signs and symptoms of these diseases. Irritable bowel syndrome symptoms include abdominal cramps, bloating, diarrhea, and constipation that cannot be explained by other conditions. Ulcerative colitis symptoms are similar, but they may also include blood in the stool. If a patient reports symptoms like this, encourage them to consult their primary healthcare provider. Psoriasis patients taking TNFi for irritable bowel syndrome are also at risk of developing psoriasiform eruptions. If these present, dermatologists should treat the patient on a case-by-case basis. A fourth takeaway from the guidelines is psoriasis patients are at risk for chronic renal disease. Patients should routinely get blood work done in order to monitor for kidney disease, such as elevated blood urea nitrogen, creatinine, and urine microalbumin. If these lab results do come back elevated, the patient's primary care physician should be notified immediately. To learn more about these guidelines, click the link to the paper in the video description, and download the Figure 1 app to see psoriasis cases from around the world.